What's up, fam? Hey, thank y'all for tuning in once again to the Growth Network. Today, I guess I'm going to touch on a controversial topic. Oh, man, this is crazy. I don't really know how I'm going to 100% approach this, but all I can do is I'm going to state the facts, show you what I see, and we're going to go from there. But this is crazy, man. So we're gonna dive into it. We're gonna get into it. So I hope you got time today. I hope y'all got time today. This is out of the dailymail.com. Like I say, I like to get all of my in-depth stories from the Daily Mail because shoot, they bring in all the research and all the facts. At least they seem to. So it says, New York's NYC opened safe, quote-unquote, shooting dens in East Harlem and Washington Heights for drug users in an effort to curb record high overdose deaths. When I saw this, man, I thought this got to be the craziest shit I've seen in my life. They are actually legalizing drug use. Isn't that like a federal crime? I mean, the first thing I thought is, okay, what about, I'm thinking about my people and getting arrested for weed use. When back in the day, you get arrested for crack, which was heavily pushed in the black community, heroin, back in the day, which was heavily pushed in the black community, but now it's a lot of them other people doing this stuff, which keep that in mind. So let that be part of your understanding. But all this stuff went on for decades. And what they do with us, they put us in jail. Lock us up, put us in jail, let us out to go do it again, lock us up. Like a vicious cycle. Anyway, let's get into it. Training staff at New York Harm Reduction in Harlem and the Corner Project in Washington Heights will monitor users and provide clean needles and naloxone. The announcement on Tuesday made by Mayor de Blasio made New York City the first city in the country to officially authorize safe havens for people to use narcotics. The measure comes as an effort to curb overdoses, the mayor said. According to health department studies, the center could save 130 lives per year. I can understand that. That part, I know. You want to stop people from dying from doing drugs. I understand. Overdose deaths in 2021 set to outnumber those the city reported in 2020, which was already the deadliest year since fatalities began to be recorded. During 2020, over 2,000 individuals died of an overdose in New York City. Almost 600 deaths were recorded just between January and March of this year. We do know that a lot of these deaths are coming from fentanyl overdose, right? That somehow somebody's getting a hold of this very powerful drug, synthetic drug that it takes like, let's say like a pinhead, like I should think a teaspoon could like wipe out a whole damn city, but someone getting a hold of it, mixing it with the heroin or the cocaine or what have you, to try to make it more, make it more potent. They're mixing it wrong and killing these people. That's where a lot of your deaths is coming from, but let's move on. New York City opened the first legal supervised ejection site in the country on Tuesday in an effort to curb the staggering spike in overdose deaths in the city since the pandemic hit. The sites, which already operated as needle exchange centers, will also make available treatment counselors, care coordinators, and referrals to other medical services, city officials said. And then I think about the show, remember the show The Wire? It came out about 10 years ago when they had these, needle exchange sites where they would, let drug addicts come in, bring in dirty needles, exchange for clean needles because, these people catching, diseases from sharing needles. So they just making sure that, hey, if you're going to do this, we don't want you to do this. But if you're going to do it, since the government is technically not doing anything to help you,
to get off of this drug. All they're doing is putting you in jail, then letting you back out so you can go back and do the same thing. The least we can do, next to ignoring you, is to give you needles, clean needles, so you can go back out there, do dope, and get arrested without a HIV, without a STD. They even hand out condoms, you know? So I guess this is a thing that goes on throughout the country. Mayor Bill de Blasio applauded the move to authorize safe havens for people, and you know, the Democratic mayor, I believe. Safe havens for people to use heroin and other narcotics. Again, this is something that them folks are dying of a lot of. When it was just our people, you wouldn't do anything to help them. But now, since the mother folks is dying of this stuff, now it's, we gotta jump on it before it get too bad. Saying he hopes the sites will help curb overdose. Why not help curb use? There were 600 reported overdose deaths between January and March. I said that. The Center of Disease Control projects that across the United States, more than 90,000 individuals died of a drug overdose in 2020, the worst year on record. Again, we're talking about fentanyl, y'all, not just the regular old school stuff that was used that our parents and grandparents knew about. It's that new drug. According to the Health Department study, the center could save 130 lives. The Overdose Prevention Center, commonly known as Supervisor Ejection sites, have been discussed for years in New York and some other cities such as San Francisco, Boston, and Seattle. Keep San Francisco on your mind right quick. Boston and Seattle, and already exist in Canada, Australia, and Europe. All European people countries is where these sites exist, right? A few unofficial facilities that operate in the city for some time, allowing drug users a monitored place. I am tripping. The New York Harm Reduction, one of the centers, tweeted on Monday, for more than 29 years, we have dedicated our lives to ending overdose deaths. But you know what? Being a devil's advocate, one reason why one point I won't knock him for is one person can't be a part of every cause. And that's one thing we got to realize. We don't want anyone doing drugs. No one becoming a drug addict out there on the street, doing whatever they need to do to get this high, to treat this chemical imbalance themselves in their brain. So they go out there and, do whatever they need to do to get this money, to get this drug, to get the money just to get the drug. But everybody, like I said, everybody can't focus on every cause. So you have to have people who's trying to stop drugs. So if you got these counselors and these care coordinators who are out here to try to get people off of drugs or prevent people from doing drugs, well, they got to go somewhere where they can find the drug addicts. So places like this is a great place for them to reach somebody. You know how they say, if I can just reach one, that's enough, which I don't believe that. Hell, I ain't just trying to reach one. That's I ain't gonna say it's a waste of time. I'm trying to reach them all. Regardless of anything, whatever you're trying to do to build and grow and do right, you want to reach everybody. So you want to reach as many people as possible. So I can understand that point with this. Proponents say the facilities save lives by recognizing the reality of drug use and providing a place where users are watched for signs of overdose. But to have a place, and when you see these pictures, this place is clean as hell, but to have a place where people can go and shoot up is crazy, especially when doing drugs, and possession of drugs is a federal offense. This is one of those things where it's like, man, you got to be crazy, or you got to be one of them folks to even want to go in a place like this, because it's kind of like people with these weed places, these weed spots. Statewide, you can start weed shop, recreational shop. We ain't talking about the medical. I'm talking about like the recreational shops that's popping up all over the country. And the states are allowing them to do this with impunity. But yet, it's still a federal offense, so you can't put the money in federally funded banks or that's insured by federal funds. So you have to stash the cash or invest it in something else. And people can refuse the money if they find out that it's from, a marijuana facility. And at any time, the feds, if they choose, can raid the place because they have jurisdiction over every state in the country. So it's kind of crazy like this. Like I say, drug use and drug possession is federally against the law, although the city and state is allowing this. So feds at any time can kick in these doors if they want and shut all this stuff down. So I can't fathom this. Let's say overdose prevention centers are a safe and effective way to address the opioid crisis. I'm proud to show cities in this country that after decades of failure, a smarter approach is possible. A smarter approach would be to find the root cause, to get to the root cause of this. A smarter approach would be, let's start with what's the problem in the community? What would cause the majority of the people, or a lot of the people, to get on drugs or to become alcoholics? Stress. Peer pressure, yes. But let's say stress. Stress from a lack of being able to support yourself or your family. You might think it's a cop-out, but it is why people turn to things. I know when I be quote unquote stressed out or upset or trying to figure out ways to, make things happen. First thing I think of is getting a drink. Now I haven't had a drink in a while. Matter of fact, I got bottles in my house now that I bought months ago, maybe even a year ago, and haven't even touched, haven't even opened. Cause I think about it, but I don't go do it because I know that being inebriated trying to figure something out is like it's hustling backwards. So I don't do it. But people do turn to the bottle or do turn to drugs or do turn to cigarettes or whatever to trying to cope with problems. So, and a lot of times the problems stem from, like I say, let's start with a lack of education. Proper education, because the school systems are BS. A lack of jobs, well-paying jobs or careers that you can get into. Because the school took out the the trades in these high schools. They're bringing some of them back, and then they got some in the medical field because they see a need of it. Because there's a lot of people getting older, people getting sicker, so they need the workers. So they let people get certifications and actually I think nursing degrees like when they get out of high school now. So like I said, there's a need for it. So they're going to push for it. But you got other trades that these kids could learn and get certified for that they took out of these schools. And it's, like I say, limiting what people can do, but you can go work in some of these places. You get a job anywhere. Make $10 an hour, $12 an hour, which couldn't support anyone, not in these days. I was making $10, $12 an hour 15 years ago and was barely making it. So, with that still being the salary, in the pay right now, it's worse than and then with the inflation and thing. But again, people get on drugs and find ways to cope because of situations like that. Let's start with the root problem. Just a lack of education and jobs, good, well-paying jobs. That could be something that you could try to fix first, and then we could talk about this, because then you have the majority of people who will just be doing it really for recreation, and then you can kind of get to them a little easier. Eva Chan, a member of the Community Board 11, told the New York Times she worried the placement of one of these sites in East Harlem would affect the way the neighborhood is seen as a place that condones drug use. We're talking property values, people.
Quote, if every district in New York City had one site and is not right next to my home, I'm not against it, but she said, which a lot of people, out of sight, out of mind. Like, you can have liquor stores all over on the black side of town. But you put it like right here, you know, put it like in a neighborhood that, you know, with big houses and big yards and big cars and big money. Ain't nobody having that. No. You put that on that side. I go over there and get it when I get ready, and then I want to come back home. But I don't want that kind of stuff around here, because I don't want no alcoholics and bums hanging around my neighborhood. You see what I'm saying? But the root cause of why people are shooting up here is that they've been using East Harlem as a dumping ground for a long time, so they don't address the root cause. Again, kind of back to what I was saying about the root cause. Sam Rivera, director of On Point New York NYC, operator of the Corner Project and Harm Reduction, also told the Times he was confident the sites were the right step towards preventing overdose deaths. Like I said, I understand you want to prevent deaths, so you want to be able to control it. I get it. I know deep in my soul that we are doing the right thing, Rivera said, told the outlet. The data does not lie. So speaking of data, because I can read this whole article. Well, this article is pretty much the end of this article. Let's go to the data, shall we? There is, and I will put this in the description box. Like I said, we're finna get into this. This is on drugabuse.gov site. Title of this 18-page, I guess you want to call it a manifesto, I'm not sure. Department of Health and Human Services, National Institute of Health, National Institute on Drug Abuse. The title is Overdose Prevention Centers. This is written by Lawrence A. Tabak. I guess he's a PhD, principal, deputy director of the National Institute of Health. So let's see what he says. This is an 18-page, like I said, report. We ain't finna get into all this. It's really maybe about 7 or 8 pages, because a lot of his references and some of it just table contents, introductions. And what we're gonna do, and what this paper says about these overdose prevention centers. Let's see. We're gonna read a few excerpts from it. It said, according to the CDC, over 70,000 Americans died from drug overdose in 2019. Provisional 2020 data shows further worsening drug overdose numbers, and one of the sharpest increases in annual drug deaths since 2016. Again, fentanyl, synthetic. Let's see. When increased availability of synthetic opioids like fentanyl drove up the number of fatalities associated with the opioid overdose epidemic. Michael Jackson died of fentanyl. Nobody got nothing to say. Prince, supposedly dying of fentanyl overdose. Nobody got something to say. But them folk dying of fentanyl every day, and it's on the rise. Now we about to open up some facilities so people can shoot up. But them two people didn't shoot up. They took it because of painkiller, trying to sleep, and just got rock wrong. And these folks out here doing this on intentionally. So you call it accidental overdose, but if you actually shooting up drugs willingly and knowingly, illegal drugs, is that really accident? Come on now. The majority of the over 800,000 drug overdose deaths in the United States over the past 2 decades involve opioids, including prescription opioid and analgesics, heroin, and fentanyl. Currently, deaths involving fentanyl, cocaine, and methamphetamine are continuing to rise. So, trying to get down to, it's on page 10, if I'm not mistaken. Let's see. Effects of OPC on other health outcomes. What they're saying is that while the effects of the OPCs on hospitalization rates are not yet clear, best evidence from cohort and modeling studies suggests that OPCs are associated not only with lower overdose mortality, approximately 88 fewer overdose deaths per 100,000. 88 fewer overdose deaths per 100,000.
100,000 person years, according to the most positive estimates. But also 67% fewer ambulance calls for treating overdoses and a decrease in HIV infection. Now, the HIV infections come from the clean needles and being able to go to these treatment centers and shooting up this heroin. But just saying only 88 fewer overdose deaths per 100,000 people. That's not a lot. That's not even 1%, not even a tenth of a percent. I mean, 0.5%, not even. That's not a lot. But you think about, now I won't even bring that jab into this. We ain't finna go there. I'm finna bring that jab, this at all. Let's see. So, effects of OPC on drug use behavior. There have been persistent concerns raised that OPCs could increase illicit drug use or alter drug use-related behaviors in ways that could worsen morbidity and mortality outcomes amongst people who inject drugs. However, such concerns do not appear to be supported by the available evidence. And we're going to get into this part. That's one part we're going to get to about this available evidence. Indeed, the establishment of OPCs has not significantly altered community drug use patterns, including rates of injection, initiation, relapse, or cessation. In terms of drug use related behavior change, one study found that Vancouver people who in PWID, let's just say that, who reported that some, most, or all of their injections took place at the Insight OPC were 70% less likely than other people who inject drugs to have borrowed or lent syringes in the last 6 months. That's pretty much the main thing. Is the biggest change is that people just using clean needles, but they still doping up. It said the effect on crime. Let's say an opening. What did it say? An opening incident was not associated with any increase in drug dealing or drug-related crimes in the area where the facility is located, a result that is consistent with the lack of any measurable impact on rates of crime such as burglary, theft, and robbery 6 years after the opening of the site in Sydney, Australia. It is, however, extremely difficult to disentangle crimes trends from other changes that occur over time. For example, a 2013 study concluded that trends in property crime incidents and illicit drug crime incidents were the same in the immediate vicinity. So it's not changing. All thing it's doing is keeping people from catching HIV. But I wanted to get down to this limitations. Limitations. After more than 30 years of operation, OPC research has generated scores of studies, evaluations, and even some systemic reviews that assess their impact at both the individual and population levels. However, the extant literature presents methodological limitations. See, I use these big words, just try to sound like smart, but really ain't saying crap. Limitations which make it difficult to draw definitive conclusions. The majority of studies come from a few sites, with close to 80% of the peer-reviewed literature based on the Insight facility in Vancouver or the MSIC in Sydney. The evidence base regarding the overall effects of OPC is limited not only in location, but also in quality. No study involved a randomized controlled trial, and the interpretation of quasi-experimental or simulation studies warrants caution. In addition, while there appears to be little basis for concern about adverse effects, the evidence for OPCs being a direct cause of favorable outcome is minimal. Basically, what it's saying that they open up these sites and they don't know if it's doing good or bad, except that 88 out of 100,000 cases, or very few people, they're stopping them from dying. Because what it's saying is a lot of people are overdosing on drugs daily. Yes. What this place does basically is if someone comes here to shoot drugs up legally, let's just say it, and they start to overdose in the facility, they have the resources to keep it from dying. period. Because it just say that there have been no deaths in these facilities since they've been open in these other countries. So basically, I ain't saying it's all because every life, I guess, is important no matter what. But it's just saying that these guys are not really doing a whole lot, but for them to spend this money on this facility, spending the money on creating these facilities is crazy. But let me find this one thing, and then I'm going to be done with it. And this is the socioeconomic impact of these facilities, which may just, let you know, break it down, the reasoning behind it. And it's always about money. It's not about your life. It's not about your well-being. It's about their money and what it's costing. They'll say the taxpayers, but really what it's costing the government if they don't do this. So let's read this. The question of how or whether the insight model could be applied successfully or cost effectively in the U.S. Because anything you have to do with medical, it's always going to come down to the dollar. Just look at your insurance. Insurance goes up. They don't really cover a whole lot. They cover a little bit, but they try to do everything they can to keep from paying out payments. Paying you for any kind of claim you try to make. You try to go to the doctor, they're gonna try everything they can not to pay for certain medications, certain procedures. So they'll do a lot of research to figure out ways not to do it. I'm gonna tell you, when I worked for the VA, shout out to their medical plan, their benefits, because when you go to the doctor, some of these insurance places are not gonna go in. Let me say it like this. You go to the doctor and they send you a bill and they claim they did all these procedures, all these tests. The VA will do a thorough investigation on what these doctors claim they're going to do. And they will say, look, there was no need for this, that, and the other. We're not paying it, and the employee is not paying this. Pretty much y'all are shit out of luck when it comes to trying to get money for this. And that's going to be the end of it. I mean, I saw this when I saw a Dr. Bill. I was like, man, this is crazy. I don't remember doing this stuff, but then really? So I give government insurance, I give them I applaud them for that. But some places will sit there, the doctor will put this stuff in, and some of these, some insurance will just like, you got to pay this. I say, well, I don't think they did it. They say they did it, and it goes back and forth. This here is like, don't worry about it. The government gonna take care of this. So I applaud them for that. So anyway, back to this. So the question of how the insight model could be applied successfully or cost effective in U.S. cities remains unanswered. But researchers have attempted to ascertain the potential cost. Let me get a dictionary at the source out for this. Potential cost effectiveness of this approach in the United States. According to one model based on the Vancouver program Insight, it was estimated that it would cost $2.6 million annually to operate an OPC in San Francisco. Remember I said, pay attention to San Francisco, or remember San Francisco earlier. The researchers calculated that each dollar spent on this center would generate $2.33 in savings, for a total annual net savings of $3.5 million for a single 13 booth OPC. I think the New York one got 16 booths. These results suggest that an OPC in San Francisco will not only be a cost-effective intervention, but a significant boost to the public health system. Since community reluctance to accept an OPC location is another important factor to consider, it is important to mention the consistent
observation that initial objections to the OPCs from local stakeholders tend to disappear following their implementation, a phenomenon that was observed in multiple locations. So basically, and this is where we're going to conclude this video, if they can make money or if they can save money, then they will be behind it. That's how the system works. It's all about the bottom dollar. If you can save a city $3.5 million a year for every facility open, trust me, they'll take them fair chances, and there's going to be more of I think New York got a few that's open today. So there are going to be more and more of these facilities being open. They're not trying. They don't care if you get off drugs. As a matter of fact, as long as this thing is open, they're going to encourage you to come back and get high in these places. As long as this thing is open and they are saving the government money, like I say, $3.5 million per year per building, per facility, man, these things are gonna pop up all over the country. And the feds are gonna overlook it. They're not gonna raid it. That's why the feds are not gonna raid it. Because just like they're not really gonna raid those weed spots, those medical marijuana spots, because although it's illegal, man, the feds are making money off this. If they wasn't making money, man, they wouldn't allow it. Come on now, you know it, and I know it. So in the end, this is a bunch of BS. I hope it can help many people of all races, especially mine. I'm looking out for mine first. I hope it can help everybody, you know what I'm saying, keep it from catching transmitted diseases. Hopefully they can talk to some counselors that can help them kick the habit and get off drugs. And eventually these places can be shut down and no longer being needed. But like I said, as long as they're making money off of it, just like the prisons, and they're building all these prisons, they're gonna find a way to keep the facilities full. I guarantee you that one. But anyway, tell me what you think. I know it's kind of a long video, half an hour, but man, like I said, I had to get into this because this is deep. You know what I'm saying? This is deep and this is important. And I had to get down to the root of it because I went to the Daily Mail and saw the article, but I'm like, it's got to be something else behind it because it just don't make sense. Why would they do it this way? Like openly allow people to use drugs. But anyway, tell me what you think. Leave your comment below. Hey, if you wanted to support the channel, go to the description box, purchase some merchandise. You know, it's like fair exchange. You give some money, you get a product. You know, if you have a YouTube channel or plan on starting a YouTube channel, go to the description box and click that $2 link. You know what I'm saying? Subscribe to it. You got a free plan. They got the paid subscriptions, but it'll help you find the hot topics for the day, and also give you like keywords that you can use to create these stories and get more viewers, which in turn to get you more subscribers, which is what we do this for anyway. But with that being said, I leave you the same way I came.